Hi all, welcome to this lecture on ethical considerations in physiotherapy practice as part of your online course. And even though it is an online course for this particular one, I always do like to acknowledge where the university that you're studying at sits. So the University of Notre Dame, Australia is proud to acknowledge the traditional owners and custodians of this land upon which our university sits. The university acknowledges that Fremantle campus is located on Whadjuk country, the Broome campus on Yawuru country, and the Sydney campus on Cadigal country. We acknowledge the Whadjuk people of the Noongar Nation as the traditional custodians of this country and its waters, and the University of Notre Dame Fremantle stands on Noongar country. We pay our respects to Noongar elders, past and present, and acknowledge their wisdom and advice in our teaching and knowledge activities. So in what is going to be hopefully not too long a lecture, we are going to look at ethical considerations in practice. And I know you have all done or learned quite a lot about ethics in your core courses over the last 3 years or so. So by no means am I going to repeat that. I'm going to try and put it in the context of what you will soon all be, and that is registered physiotherapists. So some might say that as registered health professionals, we need to basically balance the art of clinical practice with the science of making diagnoses and understanding body structure and functions. So as you will have already learned in your core ethics course, there is a difference between ethics and the law. Again, you know, I'm not going to go into the whole history, but obviously there's Greek and French meanings behind the actual words or the word ethics. And it's to do with moral philosophy, characteristics of spirit and culture. Ethos is a word as well in the Greek, or ethikos is the Greek and ethos is the French. So when we talk about ethics, obviously as you guys know, they're basically unwritten codes guiding human behaviour. So when you're in practice, it then must involve a personal and situation-based judgment on whatever ethical situation you are facing. Basically, ethics means the science of a standard human conduct, whereas the law consists of a set of rules and regulations to keep society in check, basically. Ethics are those guidelines and principles that inform us about how we live or behave in a particular situation. And look, sometimes ethics do actually become law, but we're going to focus today on what biomedical ethics are. A little bit about where they've come from, but basically what they are and how you need to model your practice around those. So obviously when we're applying these ethical considerations, it takes a lot of things into account. Your knowledge and the knowledge that exists in bodies of literature or research surrounding the profession, so evidence, your own experience, so obviously your backgrounds, your personal backgrounds, but also your experience in clinical practice, which is obviously new. Also, it uses or takes into account your own intuition, your integrity, obviously clinical judgment and compassion. And we as physios, like many other medical professions, have a code of ethics or a code of conduct, and that takes into account all these things, but it's also there to protect the public and us. So a little bit about the history, and it's not a history lesson, but it is important to know where medical and biomedical ethics come from, as it's what we're talking about in this case, not the whole ethics course that you've already done. And you'll be familiar with some of the names up there, some of the philosophers, obviously these guidelines. So when society was developing or becoming more modern, there were religious leaders and philosophers who basically came up with some guidelines to keep us all safe, but also to kind of form a bit of a model for society and how we should all act towards each other. And it is separate to religion, but some of the history of it actually came from religious leaders. So leaders in Islam, Buddhism, Christianity and Taoism. And you would have heard of obviously some of those religious leaders, but also very early philosophers, Plato, Aristotle, Confucius, and Hippocrates. And you would have heard of Hippocrates. So that's where the Hippocratic Oath that doctors take when they are newly registered. And that's all about, you know, doing to others basically as you would have them have done unto you, but also coming from a place of compassion and doing right by people and doing people no harm. So later, some of those guidelines were basically modified and put into writing. And one of the most important kind of people that did that in the mid-1700s was a German philosopher called Kant, and then others more recently than that. So the ones you'll hear about mostly in this lecture, but also in any kind of research into biomedical ethics, will be Beauchamp and Childress. So that is really important work in the 1970s. They're American philosophers and published a very famous book called The Principle of Biomedical Ethics in 1985. But, you know, without kind of going into too much detail, there was a huge study in America that was completely unethical, and it led to a lot of these ethics being developed. So there was a study on African-American men who had syphilis, and basically they tracked these men and withheld treatment from them, and the disease is obviously curable with a single shot of penicillin. So it followed these men for about 40 years. And obviously many of them died. Many of their wives and children also contracted the disease. And it's led to a raft of health issues in African-American people in the United States as well. So the entire study was unethical. And the work that came after that basically pioneered a set of ethics so that people would be treated fairly and have autonomy and choice. So all those words that you'll hear that come into the principles of ethics developed after that study. And that's often how laws and ethics and codes of conduct occur, is because people look back in history and realise that things were not done fairly, and that there needs to be some control over that. So obviously when you are a health professional, you need to make decisions based on what those ethics are and what your code of conduct is, but it involves making a decision. So ethical decisions are obviously shared with the patient and family, and we obviously adhere to sort of a patient-centred or family-centred approach in all our assessments and treatments and goal setting, but also the decision-making is shared with the service or funding body that you happen to be working under at the time. But all these decisions are underpinned by ethical theory, and you can read in depth about what those are, but in the case of being a physiotherapist, you have a code of conduct that you can refer to. Professional ethics, which ours come under, are much more complex than social ethics. And as physios, we need to consider ourselves and our fellow professionals, as well as our patients and our clients. So some of the funding bodies that I'm talking about, so obviously there are legal ramifications if you don't make the right decision or you're making an unethical decision. But there's legislation around funding bodies such as the NDIS, workers' compensation, the aged care funding instrument, so all those things. So sometimes decisions are quite complex, but, you know, we make decisions sort of focusing on those current skills that we have. Yes, the attitudes and actions that us and our fellow professionals have, and always we have to bear in mind that we need to listen very carefully to our clients. We have to listen actively. We have to think reflexively, and we have to reason critically. So you're learning a little bit, and you have, about clinical reasoning and critical reasoning, and that's basically what it's all about. So, you know, when we talk about science and art and research, potentially all of us are clinical researchers, because we are putting into effect an intervention based on goal setting, but an intervention on a client, and hoping and knowing that it should work and seeing that result. So potentially a clinical researcher is all of us, even though you might not be part of an actual study. Clinical practice is research, and clinical research is clinical practice. So they're all interchangeable, and professionals all over the world can be held to account through codes of ethics and codes of conduct. I've just used an image from Creative Commons there because I'm allowed to, but obviously around the world people look at codes of ethics, and medical and for physiotherapy, but they're very similar. Obviously doctors have different types of decisions to make. So when we're talking about practice and research, obviously there is sometimes tension between the two roles. Obviously there's an obligation that we have as a therapist to the individual patient. There's also the obligation to greater knowledge of our profession and of the health system as a scientist. So you're graduating with a Bachelor of Applied Science. The patient's obviously inalienable right to the best available management must take precedence if there's a conflict between those two roles of practice and research. And the code of conduct kind of is very clear around that, but you know, so are biomedical ethics. So what's the technological imperative? So, you know, think of all the technology that's been invented since the bioethics and medical ethics guidelines were first around. So some of those first philosophers, and even the Beauchamp and Childress. Think of everything that's happened since even the 70s when that first began. So, you know, some of the ethical considerations we face are even more important now. So with things like social media and mass media, so the pressures on society. So ethics, if you think about it, are also based on the morals of the whole society and what is currently acceptable or not. So sometimes ethics do, codes of ethics and things do change, but you know, think about things like changes in the attitude towards fertility treatments, euthanasia, for example, which are obviously outside the scope of a physiotherapist, but they do change over time. But there are also laws around things like advertising and incentivisation for various medical professionals as well. So, you know, some of those become even more so important when you think about social media. So and I was sort of trying to sort of make it more relatable to you guys in the current situation. And I talked about fertility, but on the news a couple of weeks ago, there was a segment on researchers creating a cellular organism that was very similar and behaved very similarly to a human embryo, and they had created it out of skin cells. And you know, so just sort of starting to think about all the ethics around that. You know, in terms of, you know, and there's been similar times in history where people have, you know, tried to clone animals or humans or whatever. So, you know, this is where ethical considerations come in, and whether achieving some of those things in science matches with the current views and morals of society at the time. Again, a little bit not so specific to physio, but obviously there are different expectations in society, and obviously then some of those decisions we make increase our responsibility around making ethical decisions. So again, Beauchamp and Childress and another English physician called Thomas Percival was the champions, if you like, or championed 4 principles of biomedical ethics. So this gets a bit more now specifically into what we're talking about rather than ethics as a whole. So the 4 principles are there: autonomy, beneficence, non-maleficence, and justice. So therefore, they can be sort of expanded into 7. You'll sort of see some of the medicos divided into sort of 7 principles, but those are the 4 main principles. Whilst they're equally important, sometimes one will override another depending on what the patient is capable of doing. Justice is also sometimes called, I'll come to it in a little minute, but you obviously, when you are trying to be just in your decision making and your treatment, it's really important to not impose your own attitudes or beliefs or provide your own rules to someone else. And you also can't, based on your own knowledge and beliefs, identify or judge what is good and bad. You might be thinking it in your head, but you can't allow that to affect your decision making in your treatment. So all these decisions need to be considered within what's called a constructive dialogue. So constructive dialogue in this sense is a moral dialogue. So it's a series of considerations between what you're thinking, so yourself, and the code of ethics, or yourself and others, and that discussion, which can go on between you in your own head or with other people, revolves around the issues of morality. And when it says there, so you cannot a priori identify good and bad. A priori knowledge is knowledge that comes from the power of reasoning based on your own self-evident truths. So that's what those things mean, if you're wondering. But underpinning these ethics, or the 4 principles of those ethics, are things like really clear boundaries, commonly accepted norms of behaviour, and that does rely on society, your own society, and the upbringing you've had as well. Respect within and outside the profession. It's also about protecting the inherent rights of our clients and the rights of the profession. But we'll go into the 4 principles in detail in the next couple of slides. Jumping around a bit, sorry. So this is sort of where we get into a little bit more of an explanation. Obviously, autonomy can trump, if you like, some of the other principles. So it's often used as that sort of trump card. But to avoid this, that's where you sort of try and anchor those principles in that moral or constructive dialogue. So you sort of got to find a decision based on what's most coherent within our moral beliefs and society's beliefs to resolve conflict. And that is what considered judgments are. And then, you know, again, some of these are based on philosophers and people who've sort of made these ethical frameworks or principles written. But obviously Beauchamp and Childress are those champions, some of those champions. But what we need to also acknowledge is that over time, and, you know, codes of ethics are changed over time as well, we still use, and our professions use, the highest and most generalisable principles. So they are sort of adjusted continually to reach that sort of ultimate goal of reflective equilibrium. So trying to match decisions, or a framework about decisions that takes into account society at the time, but also our own professional behaviour. So when we talk about autonomy, it's about the client having the right to opt out of any treatment options that are available to them. So it refers to the patient's right to make decisions for themselves according to their own set of morals and beliefs. So clearly, as a physio, patient education and conformed consent are really important elements of proper autonomy. And confidentiality also fits loosely under this principle. You know, and I put some images up just to illustrate. Unfortunately, no Australian images are available on Creative Commons, but you know, it does often, you know, make you think, well, whose autonomy are we really talking about? Is it the client's or the guardian, their advocate? And it really should be the patient, unless they are not capable of making decisions for themselves, or they're medically not capable. So they're either incapacitated in some way or incompetent, medically incompetent. And in that case, they would usually have a guardian or an advocate who can make decisions for them. So we need to also think about how certain choice, and it's not often life or death in physiotherapy as much as a medical profession, but there are still really important decisions we need to make. And you need to always make sure that the client's been as fully informed as possible of the benefits and risks, and understand the information to give consent, or that their advocate has or can. So part of this also, and you'll see it elaborated more in some of the medical ethics, and if there are sort of 7 principles rather than 4, you'll hear about veracity, which is truth-telling. So it's being honest, telling your clients the full risks and benefits, but it's not telling them information they don't necessarily want to hear. So, for example, physios definitely don't disclose details of a diagnosis if you happen to know it and the patient doesn't. So you can't cross that line, especially as a physio, and be telling patients things they don't want to know or they haven't consented to know. And it does happen as a physiotherapist. So I do have an example, and that is I was working as an injury management advisor with a client under workers' comp. The client was experiencing a lot of pain, lower back pain. So we're sort of going through the usual, workers' comp assessment and treatment plan, making sure that she had the right treatment and those kinds of things. And she was still experiencing a lot of pain. And she was also on a long list of very strong painkillers, including opiates. And I was sitting in a occupational physician's room with her, because that's what you do as an injury management advisor. You need to make sure that they're getting the right treatment, seeing the right people, but also progressing along, hopefully, a pathway back to work. And in this case, I was really shocked with some of the medicines she was on. And I questioned, it was a new doctor to her. I was questioning that list with her in consultation with her, and just sort of saying, look, she's on all these things, but still in an incredible amount of pain. Can we look at this? And there were also some red flags. So in my assessment, I'd come across some red flags that were consistent with possibly something nasty underneath. And as physios, you quite often will go through that list, questioning people about red flags. Does it wake you up at night? Is there recent unexplained weight loss? All those things. So there were red flags, and I mentioned those to the doctor. He sent her off for some scans. And unfortunately, I think because I was on the list as an injury management advisor, and it says something about confidentiality that wasn't adhered to on other people's points of view, but I ended up getting the result of her scan, which unfortunately for her showed that she had pancreatic cancer, and hence pain and all the other things. And so I knew before the patient did, which is really not ideal, and an oversight on other people's behalves. But I would never be allowed to inform the patient that that was the case. So all I could really do was inform the patient and her daughter that they needed to attend the GP straight away. And I did that, trying to not put panic into my voice when I was saying it, but that they would have to go and see the doctor, and then I'd need to know that they would attend that appointment. I actually made the appointment for them. So it was difficult, but sometimes it does happen. One, it's important to ask the right questions and not just assume that someone's on that list of drugs for any other reason than that they're in severe pain. It's also never okay to lie or deceive a patient. So, another example might be if you're in musculoskeletal private practice or outpatients. I would be more a specialty kind of area for this one, but if you were referred a spinal cord injured patient, say they were level T2 level, and they'd been referred to you by either an orthopaedic surgeon or a neurologist, neurosurgeon, telling the patient that physiotherapy would assist them, and if that patient's goal maybe was to walk, what would you do? Do you tell the patient that walking is going to take them many years and may involve assistive devices? Do you tell them that they'll never walk again in their lifetime? Do you tell them that the treatment's going to cost $120 per session, or whatever your rate might be? And if they can't afford it, if they can afford it, you'll treat them. Or do you tell them something like, look, physiotherapy may not fully achieve that goal of walking independently, but you can enhance your strength and function in addition to the treatment you'll give them. They'll need to stick to an exercise program, and then you'd review them at regular intervals to guide them over the next many months. There are decisions that you make each day that can affect someone, and you need to base them on ethical frameworks. So when is autonomy challenged? When is autonomy challenged? It's basically challenged if a client is not cognitively capable or not legally competent. And in that case, again, as we spoke about, there's usually a guardian, someone with them, or someone that you need to ask or inform to help them make a decision. You also need to take into account what preferences about the treatment that the patient is actually telling you or stating, and are they actually willing or able to participate in that treatment. So, and as I said, if you are in any doubt and you get to the point where you're sort of trying to make a decision and can't, autonomy usually trumps some of those other principles if there's any doubt. Not in every case, but in most cases. So then we move on to justice, one of the other of those four principles. So it's about the other word for it, and I think I alluded to it before that we get to it shortly. It's also known as distributive justice. So it's to do with the proper allocation of resources in a manner that's just and fair. And again, it's hard to put exact examples with physiotherapy here. It's not necessarily equal allocation of resources. Excuse my dog barking in the background. But one example I thought of was, if a physio's on the sidelines of a sporting match, and you need to decide which injury you're going to attend first. There might be more than one of you, which is good because you can, treat them at the same time. But, do you treat the sprained ankle or the dislocated shoulder, or someone who's obviously come down on their neck, and it might be a spinal injury? If it's all happening at the same time, and sometimes it does happen, people go down all over the sports field, and you have to prioritise who you're going to treat first. Or when is that justice challenged? Sometimes it's challenged with VIP or well-known patients, or someone you know. So, if you happen to be treating a team, a sporting team, and you know someone that's playing, just because they're the one that sprained their ankle doesn't mean they get seen first. So you do have to watch out for, and it's what's abbreviated there by COI, that is conflict of interest. So obviously different things can create conflict, and you do need to be aware of those. Obviously, if there's any financial factors, and there are sometimes, if you're in practice and you're seeing people who are coming in under Medicare complex care plans, for example, You know, you do need to still watch your time that you give those patients, because, you know, you're getting paid less actually per hour than you would be getting from a private patient, but that doesn't mean they don't get your best attention and the best care they can in that time. But difficult to manage your time. So then we talk about these words of beneficence and non-maleficence. So they're sort of big words, but not really. You're almost graduates. I don't know if anyone saw that childhood movie called Maleficent with Angelina Jolie. I couldn't put her face up there because it wasn't in Creative Commons. But basically, what does it mean? It means causing harm or destruction. So basically, then non-maleficence means that we're going to do no harm, or we aim to do no harm. Whereas beneficence, so obviously there's that old saying, first do no harm, but what we also have to do on the flip side of that is have beneficence. So that's a value where the provider of the treatment takes actions or recommends a course of actions that's in the patient's best interest. So you always have to act with beneficence, i.e. providing advice and treatment that is in the patient's best interest. And again, if a patient is unable, if their autonomy is compromised, so if they're incapable or incompetent, then beneficence actually will be the guiding ethic in that case. So you want what's in the patient's best interest if they're unable to make that decision. So other things that you can think about in terms of how do you know and how do you decide on what is in the patient's best interest? Well, what will happen without treatment? Or on what grounds can you decide on someone else's quality of life if they can't decide for themselves? That's where it's important to always, if you need an interpreter or a guardian or someone who's responsible for that person to be involved in those discussions. And in our case, it's really, how can this patient benefit from our care? You know, yes, how can you avoid harm, but how can they actually benefit and improve from our care? So it's not just about good versus evil, like the image that I've got there, Creative Commons. So what's the aim of an ethical decision? Basically, the overall aim is that the right person gets the right intervention at the right time, delivered by the right person, and which actually ties in really nicely with interprofessional practice and interprofessional education. So you will work in teams mostly, not always, but there'll hopefully be some other people from different disciplines around you. So it may not just be you that's the right person for that client. And as I mentioned before, and the quote is there from Spilland in 2020, as physios, we always need to actively listen, think reflexively and reason critically. And if we aren't the person that can provide the best care for that patient at that time or that person at that time, then hopefully we can find someone who is. And it obviously focuses, as I said, on your skills, your attitudes, your actions, to try and best help that client. So making these decisions, and obviously you can have an internal dialogue, but there's also some frameworks to help us make these decisions if needed. And it's all around sort of being pragmatic, so being practical. But there's also many philosophers and psychologists that have sort of created models of how we can actually make ethical decisions. And one of those people is Racine. And it's all about, okay, well, you're going to have some conflict. When you're trying to make these decisions, you're going to have conflicts internally. between your own morals and values, then obviously come to a process where you're trying to deliberate whatever the question is that you're trying to resolve, holistically if possible. Then there's a response, like an ethical response, and then an evaluation of what that response was. And then obviously it also helps you, and we're obviously trying to help you guys be reflective practitioners as well. It's like, well, when you reflect and you try and decide, well, how could I have done that better, so that in the future I can have a better outcome for my client, you actually grow, not just morally, but obviously as a professional as well. So obviously the decision-making process can have a framework, but it's also links in with being reflective in your approach to your clients and your treatment. So with these ethical principles, with us as a group, as a profession, we also have a code of conduct. And I've got that there, and I've actually just got to let my dog in. It wasn't very good. We obviously have a code of conduct, and it's based on those ethical principles that I mentioned before. The code of conduct, and I'll put a little picture of it there, but it's available online, and it's not just light bedtime reading. You actually should know this back to front, and I'd advise download it and sleep with it under your pillow. It's only 25 pages, and it goes through everything you need to know to be an ethically based practitioner. I'm not going to repeat it all here, because that's not actually my job. It's your individual job to be responsible practitioners and uphold the code of ethics. So there's no excuse for any of us ever. So obviously APRA and the Physiotherapy Board of Australia put the code of conduct out. It's the most recent version was in March 2014, but it's still valid, and they review it from time to time or as needed. So what's in it? Well, it's all about our professional behaviour based on ethical principles. So professional boundaries, things like accepting gifts from clients, social media, confidentiality, communication are some of the things that the Code of Conduct covers. Obviously, responsibility for your own health, both mental and physical, as well as public health. And that's really important and very topical at the moment, which I'll go into in a bit more detail. Obviously, we always need to reinforce health department policies and procedures, particularly in the days of pandemics. And obviously in the Code of Conduct, it's all about minimising risk to yourself and your patients as well. What else is in this Code of Conduct document? It contains important standards for practitioner behaviour in relation to a lot of things. And I'll go through the main topics, and then we'll just talk about a couple of them. As I said, but it's not extensive, there'll just be excerpts. So the standards of our behaviour as practitioners in relation to providing good care, so including shared decision making with patients and families, working with patients or clients, working with other practitioners, working within the healthcare system, minimising risk, as I said, maintaining professional performance, which involves continual professional development and things like that, professional behaviour and ethical conduct, ensuring practitioner health, as I mentioned, teaching, supervising and assessing, and research. So making decisions about healthcare is the shared responsibility of the practitioner and patients or their clients or representatives. So the code outlines everything you need to know to stay within those ethical principles. Protect your clients and protect yourselves. So some of these some of the sections that are most important, but they're not by any means all-encompassing. Section 3 from the Code of Conduct, and it's from page 10, is all about working with patients or clients and being an effective communicator. So we always have to listen to our patients, need to ask for and respect the patient's views about their health and respond to their concerns and preferences. You need to be aware of their health literacy. So they may seem like they understand, but you need to try and make sure that they are understanding what you are communicating to them. I'm not putting every question in there, every section in there, but obviously there's codes about using social media, e-health and electronic health records, being consistent with the Code of Conduct. Also communicating appropriately with and providing relevant information to other stakeholders in accordance with privacy requirements. Okay, then in case you didn't know about confidentiality and privacy, you need to treat all information about patients or clients as confidential and applying appropriate security to electronic and hard copy information so it's not accessible. You need to seek consent from patients or clients before disclosing any of that information where practicable, and also being aware of the requirements of the privacy and health legislation in other states and relevant states, and applying those requirements to all formats of the information you hold. So those are sort of very basic things. Then there's other important issues to do with informed consent. So good practice involves, and this is a quote from page 11, good practice involves providing information to patients or clients in a way they can understand before asking for their consent. That letter B shouldn't be there, I should have put it down further, but obtaining informed consent or other valid authority before undertaking any examination or investigation, providing treatment, other than obviously exceptions like emergencies. Then when referring a patient or client for investigation or treatment, advising the patient or client that there may be additional costs, which they may wish to clarify before proceeding. So there are very, very detailed wording in this Code of Conduct that you always need to make sure that clients understand, particularly when, as I've referred to before, if the client has impaired capacity or limited capacity, and often they will need a guardian there, or a surrogate, often called. What about professional behaviour? So section 8, so this is another quote from page 18. And really important, particularly as new, young physiotherapists out in the world treating people that you've not met before, and we are all friendly people and we probably try to be, but there is a fine line and you must never cross professional boundaries. And it happens as students as well. So you must never ever use a professional position to establish or pursue a sexual, exploitative or otherwise inappropriate relationship with anybody under a practitioner's care. This includes those close to the patient or client, such as their carer, guardian, spouse or the parent of a child, patient or client. You need to also recognise that a sexual or other personal relationships with people who have previously been a patient of yours are usually inappropriate as well, depending on the extent of the professional relationship and vulnerability of a previous patient or client. It's really, really important. I think people gloss over it, and, you know, you sort of gloss over it with, oh, you know, I'm just a friendly person and, you know, didn't mean for the relationship to happen, but it's it can impact your patients severely. It can severely affect their life if you're in a position of power and you have a relationship with them, or you pursue a relationship with someone like that. And it's not just because there are ethics and a code. You know, in a single day, a physio is going to touch, potentially help dress someone, shower someone or feed someone, take someone to the toilet, speak, console someone, cheer them up. So you have a very personal relationship with your clients, but it can never cross that boundary of becoming sexual or exploitative. There's a power imbalance, and it's just not the done thing, and can also affect your registration. So someone in your care must be willing to hand over most of their agency. So health agency, I think you guys would have heard of. Remember, agency is all about someone's capability to make their own decisions about their own actions. And it is influenced by people in power. So the client always needs to have their own agency over their decisions. So more about professional behaviour, and this is to do with financial and commercial dealings. So again, practitioners must be honest and transparent in their financial arrangements with patients or clients. So things like good practice involves not exploiting the vulnerability or lack of knowledge of patients when providing or recommending services, not encouraging patients or clients to give, lend or bequeath money or gifts that will benefit a practitioner directly or indirectly, and more importantly, not accepting gifts from patients or clients other than tokens of minimal value like flowers or chocolates. And if token gifts are accepted, you still need to make a file note or inform a colleague where possible, so that none of that receiving of gifts can be misconstrued as being manipulative or having been asked for. So I think I've made that clear. I think the Code of Conduct makes that clear. And just as an example, if I hadn't made it clear enough already, I thought I'd put in some examples of decisions made by AHPRA very recently, so as recently as last year, following complaints that have been made by customers, clients, patients against physiotherapists. So some of them written there, unnecessary, inadequate or inappropriate treatment or lack of consent. So you do have to always evaluate whether the treatment you're giving a patient or advising them to undergo is necessary and will benefit them. So some of the conditions that were put on there was they had to have further education. There's sometimes a fine associated with some of these decisions, depending on what the decision is and what the offence was. Another one in Victoria, billing inappropriate fees or billing practices. And then the decision was unsatisfactory professional performance and a condition was imposed. And then there was one in Queensland not too long ago, which was a professional boundary violation of inappropriate sexual relationship. The finding was unprofessional conduct and a condition of a court was imposed. So usually those things require time out of the profession, and you sometimes have to complete certain conditions before you can be re-registered. Sometimes it's complete loss of registration. So these things are very serious. They're taken seriously because clients' lives can be affected by some of those things that happen. So without trying to be a drama queen, do go and download and read and sleep with the Code of Conduct under your pillow. There are some references just used throughout the PowerPoint presentation for you. And if you guys do have questions, although I don't have a legal background or anything like that, but I have knowledge on the ethics specifically relatable to physiotherapy, and so do all your lecturers at Notre Dame. So if you have any questions about either things you've done, things you've seen, things you've heard, and what they constitute, whether it's a breach of the code or worse, absolutely let us know. And if we aren't able to answer your questions, we can hopefully put you on to someone who can. But thanks for your time. And if you do have those questions, they're probably best via email. I know these lectures aren't the best format for people being encouraged to ask questions. So please do that if you need to. Thanks for your time, everyone, and hope you enjoy the rest of the course. There'll be some multiple choice questions, nothing too onerous on this, and hopefully you'll be able to get those. Feel free, I will upload the PowerPoint presentation as a PDF as well. but hopefully the multi-choice test for this module won't be too onerous. Okay, thanks. See you all.